We use CRISPR to correct mutations we found in the cells, and that's with the intention to eventually help patient.
In what diseases? To treat what?
So our first choice was beta thalassemia and also sickle cell diseases, very prevalent in southern China.
And these are areas that are being worked on in the United States simultaneously.
Yes, but perhaps not in the scale as you probably have in China. And in southern China, we have anywhere between 10% and somewhere even maybe 60-70% are carriers. So it's a serious health problem for us. It's a well-defined genetic condition. So there are a few clinical developments underway. I don't think we are ready as of now to really perform the human trial yet, and there are guidelines not clear, and we have to really negotiate with the CFDA, that's the Chinese FDA, and whether they will permit certain things being explored in the laboratory. So there will be a negotiation, and once we're cleared, and then we should commence a clinical trial. But before the clinical trial, we have to really undergo a very extensive clinical study. Clinical studies are normally regulated at the local level. You have provincial FDA, where you set up various guidelines for the manufacturing of the cells and different vectors. The whole clinical development. We have to really have those data ready for them to review them. And then even before that, you have to clear the ethics board, and they just like the regular IRB you would have anywhere, like in Harvard, we have our university IRB will have to go through. So they are actually, as a researcher, we have to navigate all that guidelines. And China now have been trying very hard to streamline all those processes such that innovation can be brought to the patient the bedside more quickly.
You mentioned stem cells earlier. Are you using CRISPR to alter stem cells for treatment of the blood diseases?
Well, the protocol, the idea is very simple, right? So we want to use autologous cells. That means the cells we derive from the patient. And then before we use those cells to cure or to help that patient, we have to correct the mistakes. And then there you previously, many years back, we used zinc finger nucleases. And then we use tannin later on, and then now CRISPR is much easier for us. Just the sheer cost is much lower. Yeah.
And does this relate at all to your work in neurological diseases you were working on Parkinson's and Alzheimer's?
Yeah. So Parkinson will be the same, right? So we wanted to eventually use autologous system because then you use patient's own cells, and they will be in a way more effective, and they will not subject to the rejection of the immune system. And then depending on whether the genome has any known mutation, if they have the Parkinson-related mutation, we have to use CRISPR to correct that before we can use those cells for therapy. So Parkinson, we are moving a little bit more aggressively. So hopefully the next couple of years we can do that, because we just, in our institute, we built a GMP facility. And then it's one of the best probably around the world. And then we will be able to manufacture neuroprogenitor cells and also dopaminergic neurons. And then we will first probably, we must do a preclinical study in primates. And then once we show the safety and efficacy, and then we may be able to get clearance to do human trials.